So what I said to Claire was I'm going to talk a little bit about trapeze, but I won't talk a huge amount of that because not everybody is from New South Wales. But just to give you a bit of context for where I am, we're going to watch a couple of videos and then I'm going to talk about top 10 tips for transition so everybody can take some of that away. The other question, it's a hand showing talk. Who here has got a child with TSC? Is that everybody in the room? Not everybody in the room. Okay, and can I check, is your child under 25? Okay, so anybody's child in here who has already transitioned? Everybody's child is going to transition at some point? In the process, good. Okay, so it'll all be fairly relevant. Okay, good, that's what we want. Let's get on. So before we start, I'd like to do an acknowledgement of country. So I want to acknowledge the traditional custodians of the land on which we meet here today at UNSW, which is the Gadigal people of the Eora Nation, and pay respect to elders past and present and to any Aboriginal or Torres Strait Islander peoples here in the room. It's quite historical land that we meet on here because we're very close to the Botany Bay area, and the Gadigal people are the they are the traditional custodians on the land here. So it's quite special land, and we always want to draw on the inspiration of the elders that we have here in Sydney. So Trapeze, who are we? It's a funny name, isn't it? It's not a typical name that you get for a service. So we're the specialist adolescent chronic care service for the Sydney Children's Hospitals Network. That covers both Westmead and Randwick. Some of you will be familiar with that. They are our two biggest children's hospitals in New South Wales alongside John Hunter, but John Hunter isn't part of the Sydney Children's Hospitals Network. So when we say it's a specialist adolescent chronic care service, we support young people aged 14 to 25 as they move from paediatric to adult services, as well as their parents, carers and siblings and other extended family members. What do we do? Well, we facilitate, monitor and we coordinate the young person's care, and we strengthen their links with their GP and their community, because once your child moves over to adult services, your GP is going to become and has to become your best friend. Okay, it's going to be one of our top 10 tips to make sure you've got a really good GP. So what we do at Trapeze is if you don't have a good GP, we help you find one, and we also do that for the young person. So a lot of young people don't want to have mum and dad's GP. They want to talk about sex, drugs and rock and roll, even with young people with a chronic condition, and they don't want to necessarily do that with mum and dad's GP because that's just slightly awkward. So we'll help them find their own GP if they want that, and we really do try to link people in with local services. So we actually do take ACT, young people. So if they've had an admission into Westmead or Randwick, you could well be part of getting enrolled in our service. But what we would try and do is link you up with local services as much as possible, because nobody wants to be driving miles away to get healthcare. So yes, and some of you won't have a choice, and even when you get to the adult service, you won't have a choice. No, you won't have a choice. So yeah, exactly. So you can only, like you, we're fairly limited. We can only do what we can do as well. But we like to think that we can provide you with that extra support, and even those out not in the state, I'm going to show you a whole lot of resources that you can get on our website that will be relevant to all of you. Okay, and we hope that that can kind of at least support you, maybe not so directly, but indirectly as well. We like to talk about, I like to particularly talk about our values, because I think it's important for you to know what we value, because you might think that that doesn't sit with your value system. So we definitely believe and uphold the principles of advocacy, empowerment, respect, diversity, openness and collaboration. We do a lot of advocacy for young people, whether it's trying to get Centrelink payments. It's always a minefield. We've got really good social workers who know how to navigate that system. What else? We do lots of advocacy in terms of just trying to get health services, trying to find doctors, trying to find those specialists who will take somebody. In the adult world, it's tricky. Anybody experiencing the adult world in here yet?
Me, yes. I've got 4 chronic medical conditions.
There you go. It's for yourself. Yeah. Okay. So you've got that personal consumer, they call you, a consumer, and that consumer experience, and you'll be experiencing it, and it's not easy. But don't give up, because
there's nobody for the over 25.
Yeah, it's difficult. Well, we've got some services that just don't even exist for some conditions in New South Wales as well. So we also, this is really important to us. So we do support families and carers, but ultimately the young person is our main client because we want them to become as independent as possible to the best of their ability. So we really kind of do that self-management stuff with the young person, but we believe that young people have a right to be heard, and we encourage paediatric teams all the time to start talking to the young person, to ask mum and dad, carer, relative, please leave the room. I'm going to start speaking to the young person, because once they go over to the adult hospital, you're going to be working in a very different model. Paediatrics is very family oriented, adults is very individually focused. And there sometimes doesn't feel like there's that transition of adjustment. Like they may not necessarily invite you into the room. Your young person may end up going in on their own. So.
In Victoria, my son is 29, but he can't really express fully his needs. Can't really express. He's got speech.
Yep.
He's got language and cognitive problems, but his specialists are very welcoming.
Yes. Yep.
Because he's in the CIU, but there's a lot of changes, so I do all the medical stuff with him.
Yeah, exactly. So part of the advocacy, that's great to hear, because part of the advocacy that we do is that if doctors aren't being very welcoming or aren't kind of taking that approach, that we'll advocate on behalf of the family and the young person to do a bit of education with that doctor and to say, look, this family's going to come and see you, this is what they're going to need, mum and dad need to be in the room, the carer needs to be in the room. So I'll just come back to you in a moment. And we believe that young people need to make generally informed choices and to have timely access to medical services. So our overall aim really is to help young people better manage their conditions so that they can move over to adult hospitals and stay out of hospital as much as possible so that they can live their own lives. I'm going to show you a little video now. You're going to meet Gabby and her mum Sian. Now, the videos on our website, really encourage you to go and have a look at them. A lot of them they're all young people's stories. They're not TSC condition stories, if you like, but their story is going to resonate with you. So now we'll just get this video working.
Gabby's a very unique little girl. She's got severe developmental delays and severe physical disabilities. She doesn't have any verbal language whatsoever. She can't say yes or no or answer your question. She does seem to understand a lot of the time because she's quite cheeky and she'll laugh at the very appropriate places, but she can sing. So she's got echolalia, so she'll remember things, and she can sing. And I'm not exaggerating when I say she can sing probably over 100 songs. So if you sing, she'll sing along. If you don't sing, she'll give you a line. If you don't pick it up, she'll give you another line, and she'll carry on until you find something that she likes, and she'll just sing along with you, and she'll belt it out. She's just amazing. She can count to 30, she can say the alphabet, but unfortunately she still can't give us a yes or no as to what she likes and she doesn't like. Challenges with Gabby when she was first diagnosed was nobody had ever heard of what she had, including us. So isolation was a big thing for us. We didn't fit any square holes anywhere to go and seek some help. We were told we had a child who was probably going to die very soon, to take her home and love her. There weren't paediatric palliative care services here in this area when she was born, so there was nobody to support us if she was to die. There was very little support to help us towards living. There was no organisation in Australia at the time covering her disorder. So we came home feeling totally alone. It was scary. We were scared here, we were scared if we went to the hospital. We were trying to raise 3 other little children at the time as well, and support them and do normal things. They had to live, they had to go to school and go to sport and to dancing. So we were doing all these things with the kids, with Gabby coming along with us, not knowing if she was going to wake up tomorrow. And we lived like that for probably the first 5 years. That we would go to bed at night never knowing if she was going to wake up the next morning. Navigating the health system has been tricky. I think that's probably putting it mildly. From the time she was diagnosed, there was only one specialty area for her diagnosis at that time, and that was in Sydney. And as I said, there was no support groups, nowhere we could turn to for extra support at that stage. So for somebody else now who's got a child ready to start transitioning into adulthood, I think the key thing is to have somebody on your side who knows what the process is. So through the Sydney Children's Hospital Network and John Hunter Hospitals, we've got now transition nurses that will help you negotiate this minefield, and they can become your new best friend. They really are very supportive, they know what they're doing, they've done it before, nothing will rattle them as far as what you're about to present to them, I'm sure. And even if it does, they've got the resources to tap into to help you and guide you. And my advice to anybody else, particularly in a country where you don't have the access to a tertiary hospital close by, is to find yourself a good GP. So you need someone that's going to look after your emotional health and your partner's emotional health, and to help you guide through the system, to give you the referrals. And if there's one thing I've learnt over the years is that if I don't look after myself and stay on top of this, then nothing's going to happen. But without the family with a lot of these children, particularly the children who've got intellectual issues, without the family, the child's not going to survive and succeed into adulthood. So we really need to look at this as a big holistic approach to carry on into the future. And I can safely say that we've made it to the other side and we're still smiling, and life doesn't seem nearly as bad as what it did probably when Gabby was 17. It seemed very daunting and I was very anxious, and I can smile now and say sorry. Yeah. Ready? YMCA. Ready? Yes. Take it, Gabby. Yes.
So that's Gabby and Sian. And just get this going again. Great. We'll get you out of cinema mode. There we go. So did anybody kind of connect with some of the things that Sian was talking about there? Yeah, so we do have a parent carer section on our website, and I decided sometimes I come with lots of paraphernalia to these talks and give out pens and blah blah, but we're going all electronic these days. But what I did bring, so that you don't feel that you're alone in any way with transition, no matter what state you're in, I'm going to pass around my business card, and it's got my details, and you're welcome to email me to ask me any questions, and I'll do my best. I won't probably be able to know who's who in the zoo in your state in terms of health services, but even if you need just to chat and you're a little bit concerned about anything, you can call us. So, because I normally do this in 2 hours, and I've got 30 minutes, so we're gonna go quite quickly. But please just stop me if you need to ask me a question. A lot of this stuff sounds very obvious, very self-explanatory, but putting it into practice is what I would encourage you to try and do. And that sometimes we have very busy lives. People leave transition until the last minute. Don't, is what I would say. I was going to say, we accept referrals from 14, and people say, oh, that's too young. People almost don't want to leave the children's hospital, but it takes about 2 to 4 years to transition properly, really, in terms of self-management and getting ready and preparing and doing all of those things. And we've got a lady here who's living it and telling you.
Between 16 and 18 is no man's land.
Yeah.
I've only got 2 older ones.
Mm-hmm.
One's in no man's land, and my oldest is 20. She's out of no man's land.
Yeah.
But she's now in the adult system.
Yeah. Yeah, and you'll feel like you're in this vortex of nothingness for a little bit. So finding a transition coordinator or a transition nurse, okay, you may not have Trapeze in your state. We're very lucky in New South Wales. The government has been very generous, and we've got a team of 9. We've got a massive big team for what is available in other states. But I know in Victoria, you've got Evelyn. She's a transition coordinator at Royal Children's Hospitals. Evelyn Culhane, her name is. And again, if you need her email, you can email me and I'll get it for you. And there are transition nurses in hospitals, or there are people, I call them transition champions, someone who would be interested in your clinical team. You get the ball rolling. So let's have a look so I don't start doing all the 10 tips and without even going through. So start the conversation early. Okay? Don't let your doctor bring it up. You bring it up. Bring it up with your clinical team. Say, my child's 14, 13, 12, it depends, some developmental stages are different for young people, but anywhere around that, say, I really want to start doing some self-management stuff, even if it's your self-management stuff. I want to know what's going to happen when they're 18 and how we're going to look after my young person then. Start the conversation early, because, the health system's slow. Yeah, you might be ready and you're ready, but the health system's slow. There's bureaucracy, there's appointments, there's delays, all of that. So, 2 years for us goes very quickly. Get organised. So I had some they call them cheat sheets, don't they, here? But I think I know this stuff. But yeah, get organised. So Medicare cards. Does anybody in the room here know what age you need to be to get your own Medicare card? Yeah? 15. And actually, in some cases, I've heard you can get it even younger. Yeah. I think actually you can get it at around 12 or 13, but they advertise it at 15. And all it is again, you can get this information on the Trapeze website. It's a transfer form, and you just transfer over. And what we say to young people is take a picture of your Medicare card, and you're never lost, because then when you go to your appointment, if you've forgotten your card, all they want is the number. And actually the Medicare app, do you want to tell people about the Medicare app?
Yeah, so you can get the Medicare app, and that has your Medicare card
Yeah.
number on it, and also on the Centrelink one it has your healthcare card and your pensioner card.
Yeah.
too.
And all you have to do is go to MyGov, isn't it now? It's all run through MyGov, register there. And the other thing I'd encourage you to do to get organised, anybody registered for the National E-Record? Yeah? How are you finding that?
Hate it.
Yeah.
Can't put enough information on
Yeah.
my daughter.
Yeah. Okay. Oh, so now that's interesting. So that's interesting. So it's space-wise.
Yeah.
Yeah, that big.
And they can't put all the issues.
Now that's really interesting. So if there's feedback on the national, you should be providing that feedback. Good. Because you guys are more powerful than we are. Do you know that? You may not feel it at times because the system can make you feel really powerless, but we're quite limited on how political we can be as a public servant. But you can be as political as you want to be. No, it's true, sir. No, it's true. We're quite limited, and we have to be very careful about how political we can be. But you guys, you can be as political as you want. And what you do is you write to the minister, you get on and you fill in complaint forms and you do all of that stuff, and you rally together and you use TS Australia and you do all of that kind of stuff. You're the people they will listen to. We've had services closed down, and it wasn't until a consumer had got an article published in a newspaper that the government decided to fund that service more. So you've got the power. We're just people that, do our 9-to-5 jobs. It's a life thing for you guys, and you can put pressure on. Encourage self-management as much as you can, and as much to your young person's capacity and ability, but your self-management too, okay? That's really important, how you're going to self-manage, because your child grows up and their needs change dramatically, and they're going to go through adolescence like every other adolescent, and it's going to be pretty tricky. They're going to start thinking for themselves, they're going to want to be more independent. They might even start swearing at you. They might, who knows what they might do, but it's adolescence. So we've got nods down here.
iPad, whatever.
Yeah, whatever. Okay, yeah. Seriously and whatever, apparently the latest things. Seriously? Whatever. Yeah, they're the two things. But that's what you're going to get. So checklists. These are really good things. So these are they're on the Trapeze website. You can have a look. There's one for family and carers. Fill it in, have it with you. And these are what's called workable PDFs. If you're not too tech savvy, don't worry. All that means is that you don't need to print it out. You can actually save it on your computer, and it ticks automatically on the computer, and you can just keep it as an electronic file, and you can actually even have it in your smartphone or your iPad or something like that, and just see how you go on that checklist, see where you're up to. Know your young person's condition. I know you do probably know that, but just to kind of reinforce that, definitely know it inside out. And if your young person has capacity, get them to know it too. What we do with some of our young people is we say, tell us your condition in 30 seconds. Or describe it for us. Do a little pitch, like a TV pitch, 30, 60 seconds. And if you can't do that, then we need to sit down and talk about how we can get you to that point. Because when they're talking to their friends and they're sharing that stuff, it's really important stuff for young people. Bullying is one of the biggest things that's happening at the moment. I don't know in your states, but in New South Wales, I do pro bono work for a law centre here at UNSW. It's the National Children's and Young People's Law Centre. And our main inquiries from young people is about bullying and cyberbullying. So watch how much your young person is on their device and monitor that. GP engagement, I'm not going to talk much more on that. I think that point, Sian made that really clear, didn't she, about getting a good GP. And Sian lives kind of fairly regional, it's not rural, but it's definitely regional. So it's out of Sydney. And she talked about some of her experiences of not being, you know, in the city per se. But GP, definitely get a good GP. Think about the future. You know, I know you're all busy and you're in the moment, but do think about the future and plan for that future. It's not, the plans may not stick, and that's fine. But no, that's okay. Welcome. But do as much planning for the future as you can. It will help. Transition readiness checklist. There's always checklists, isn't there? But this is a really good checklist, and you can actually take these. So don't worry if you're in another state. Print them off, take them to your doctor or your clinical team, and say, "I'd like to sit down and do this transition checklist." They're going to think, "Wow, these parents are really switched on." But they'll like it. I'm sure they'll like it. If they care, they'll like it. So, transition plan. You can get this off the website. A great little document. Again, you can type it straight in on the website. On the internet, you don't need to kind of print it off or whatever. So this is 2 pages. I didn't put the other side. The other side is really good. So this side just gives you your name, your details. On the other side, it lists your paediatric specialists and your adult specialists. So you know who's who in the zoo. So it helps you kind of stay on top of who's looking after you. Identify adult services as much as you can, because we know some of them don't exist, and get to know the adult world. Anybody know about joint clinics? Ever heard the word joint clinics? Yeah. Yvonne, what are joint clinics?
Joint clinics are clinics where you have the paediatrician and the adult specialist doing a consultation together. There aren't too many of those.
No, that's right. Yeah.
But there are a couple of at Westmead, particularly for rare genetic metabolic disorders. So the paediatrician and the adult specialist sit together for a number of consultations. And I think there's one in neuromuscular disorders.
That's right, a very good one for neuromuscular.
Although that is at North Shore, I
Yeah,
believe,
that's right.
Which means people from Westmead have to travel to North Shore.
Yeah, but it's actually a lot of people, thanks Yvonne, but people are modelling a lot on the neuromuscular joint clinic. All it is basically getting your paediatric team and your adult team to be together and talk. That's all it is. And some clinics run in a multidisciplinary way, so you'll get to go and see all the allied health at the same time, but it doesn't have to be as fancy as that. It could just be your paediatrician and your adult physician sitting there and talking, and you can instigate that. Doesn't matter if they don't have it. Say, I'd like to have a little meeting, a little conference with my adult team, and get to know them, because not many parents know this, but when you leave a children's hospital, unless your children's hospital is within your adult hospital, like John Hunter, your records aren't on the system. And parents always find this, and they're quite dumbfounded by it. And that's why the National E-Record, to a certain degree, is good, because we can see things. Because if everyone's on that National E-Record, then we've got the record. But otherwise, that big file of yours goes nowhere, or it doesn't in New South Wales. So depending on how your state is set up. So when I let parents know this, so what you need to do, which is the get organised slide, keep copies of your clinic letters, keep copies of any discharge summaries that you've had when you've had your young person's had an admission. Keep everything. Your adult specialist will get a letter, but they're not going to get a 20-year or 18-year history.
And it's even
Okay.
hard just even within New South Wales, the 2 children's hospitals sharing.
Yeah, so we're still not, and they're just about to migrate now, but they're not even on the same system. So what we've had to do at Trapeze, because we're off-site, we're based in Alexandria, we register, we give every young person a Westmead MRN record, so we've got it all on one system, but the systems itself don't. Yeah. So go figure. Okay, build a support network. Yeah, for you and your young person. Make sure your young person's feeling supported. Peer stuff is a difficult age to go through. Most young people with a chronic condition have got a comorbidity of a mental health issue, whether it's anxiety, stress, depression. So make sure that if they need people to talk, there's headspace, there's e-headspace. So your young person doesn't have to go in face to face. There's actually counselling online and things like that. And I'm sure each state have got your own quite helpful mental health services. Tip 10, don't lose your head. As much as you can, don't lose your head. So this is one of our little mottos, but it's just really for the New South Wales people and ACT. Refer early, but it's never too late. So we always try and tell doctors, refer 14, but of course they refer at 17 and 9 months. And so we're always really busy trying to do catch up. So we're going to end on a little video, if I may. Am I okay? Yep. But I thought, would anybody like to ask me any burning questions? Or I know it was really fast. We still stop through transition. Would anybody like to ask me any questions?
Now, one thing that I came across when my son had hydrocephalus last year, his burial, and but afterwards, when he was ready to go, because I stayed in hospital, and it's very unusual in the neuroscience unit at Monash Clayton, but I've always, both of us parents, my husband was at sea, so one of us would always be with him, and so because of the autism, and he was really quite flat and quite out of it, but the physios had a meeting and said that because he had autism, he wasn't able to have, after major surgery, was not able to have rehab. And they didn't ask me, approach me, and he's got private help. He paid for his own private room. We helped, but then the other thing is he could have gone as an outpatient, which would have been good, and he could have gone with a disability worker, and they could have learned, been shown what to do with him. Instead, I had to take him home. I don't mind doing it, but I get so knocked out. And,
Yeah. So it's really good hearing a story.
Something I didn't bring up to DHS at the time. He's in the DHS house. Because I think we were both, my husband and I were both sort of really traumatised over everything that was happening with him. And the thought of losing him at that stage.
Thank you for that. I mean, it's helpful. It's always helpful, I think, to hear stories from people who've kind of been through it and and how we can learn from that. And I would encourage you, even just from this conference, to stay in touch with one another and support one another, because actually your lived experience is, again, that's much more powerful and much richer and much truer to what's going on to anybody like me that could tell you what you need to do. I mean, I can just guide you or give you some. All of this stuff comes from lived experiences. I mean, we have youth representatives who sit on our committee. They tell us what to do and how to run our service, and that's how I like to manage the service there, because it has to be driven by the people that we're serving. Otherwise,
Stuck with the system, I went and got a job as a support connection.
so you went and got a job. So you entered the system.
Yeah.
Yeah.
I'm so pissed off with it. It's like, well, I do this under the NDIS, it's 2 different
Yes.
things. It's connection of supports or support connection.
Yeah.
But it's a different
Yeah.
title and a different hourly rate.
And yeah, do spend some time getting your head around NDIS, won't you all? Okay, good. So let's go, because I'm conscious of the time. So we'll get, you're going to meet Joshua now. And we like to show this video because we just think Joshua is a really positive person. And if there's any kind of message, maybe just do try and stay as positive as you can, and do get as much support for yourself as possible. But I'm going to put the cinema back on and sit back and enjoy.
Well, my name is Josh. I'm 20 years old. I have multi-mental myopathy. It just affects pretty much just my muscles. They're not as strong as they should be. They don't form like everyone else's does. It's impacted my life in a way where I can't do as many things as everyone else. Obviously the wheelchair is the biggest part of it. Does it define me? I don't think it does. I kind of just realised that the way that I go through it is what's defining me, not what I'm dealing with, kind of thing, you know what I mean? When I was younger, mostly everything was just given to me, appointments, cards, you know, but once I left the children's services to the adults, it was just, I had to pick my act up pretty much. The first few appointments were difficult to remember because it wasn't me and my mum doing it anymore, it was me on my own being an adult. I was so disorganised and wasn't able to organise things properly, you know what I mean? Like just I couldn't really remember my appointments properly or write them down, or I would forget a few all the time really. Once I got the help from Trapeze that I thought I couldn't get, that's when it started all coming together. And the appointments, I was there more often. I knew when they were. I started a folder, kept all my files in it, took them with me. I didn't forget anything, referrals, stuff like that, letters, all that kind of stuff. I go to every appointment now. It's all good, all sorted. When I met my first coordinator, she just helped me figure out appointments with doctors. She gave me a few tips on, buying a car, where to modify it, how to modify it, what I would need. If I need help, I call them up and say, look, I'm having trouble with this, I need help. And immediately emails, phone calls, numbers to ring. That'll just give me a wide variety of stuff that I need. So I have to show you this record. It's so beautiful. Isn't it just super beautiful? That's the first thing. At the moment I'm studying a diploma of counselling. My future goal, summarised, would be to be able to empathise with people that in a way no one else can. Just stay positive. It gets really hard, but they just got to stick to it because it's going to hurt for a long time, especially people fresh into it, because you just don't know what you're doing, but it gets easier. That's all I have to say.
Thank you, Madeleine.
Thank you very much.
That was a really lovely, positive note to end on. What a
great.
amazing young man. And thank you so much for showing us
having me. Thank you.
all those wonderful tips.